day. As you know, I am one of the founding directors of the Dawn Ride and Ovarian Cancer Relief Foundation. And today I have the honor of being here in downtown Vancouver with one of the world's leading scientists, in particular to ovarian cancer research, Dr. Yvette Drew. Thank you for taking time out of your busy day. I know that you still have clients and patients to see. So it's an honor. I have, if you don't mind, a couple questions. The first one is, I understand that recently you moved here from the UK and you're here in Vancouver, the west coast of Canada. What excited you about moving here to the west coast?
Yeah, so I think normally we have rain, as you know, in Vancouver, so I can't really say it was the weather that pulled me here. But no, I think the main reason was to come and work with the team that are here. So Vancouver is very lucky, and BC is very lucky because it has a huge research program and team working on gynecological cancer research, including ovarian cancer. So the team's kind of known as the of-care team. So that involves scientists, radiologists, pathologists, everybody at every sort of level of research is kind of coming together to work to common goals. So I think what excited me of coming specifically to Vancouver was to join that team, to be part of that team, bring my own skills, and my own skills are more in the area of new drug development and developing what's called early phase clinical trials, so new drugs that we can try and bring to patients with gynecological cancers. And then I have the support of the team here to be able to action those research ideas and programs. So I've come here really so that I can make a difference, but also I'm being very well supported by the team that I'm part of to do that.
I know that many of the Dawn Riders will want to know, what excites you about working in the field of ovarian cancer research. What makes you want to get out of the bed in the morning and hit the road in downtown Vancouver?
Yeah, so I think every day, as an oncologist, you hope you're going to make some positive difference, in someone's life, in the clinic or, in clinical care. But what probably excites me the most is to be involved in research, so to try to change things, to try to make better treatments, because we know there's a desperate need, certainly in ovarian cancer, to diagnose it earlier and to find better treatments, once it's diagnosed. So one of the things that I am doing through that is opening a trial called the NeoCat study, which is looking at a new way of treating ovarian cancer right from the very beginning, and to move away from chemotherapy and look at sort of the novel targeted therapies to see whether we can actually improve the initial response to treatment. Because we know that a lot of women do respond well to chemotherapy, but it will fail them later on. So we're trying to look at doing something completely different, and that's what excites me, that I don't want to be giving the same treatments that are failing women, in 10 years' time or even 5 years' time. We want to be trying to do different things. So that's what probably spurs me on.
And so my final question, and over the last 2 years, that's how long that the Dawn Ride has been out there raising funds for ovarian cancer research. And we've been quite successful. We raised $130,000. This year, we've actually given $40,000 to the NeoCats program that you just spoke of, the project that's being developed by Dr. Drew. So my question is, as we bring on more Dawn Riders, what words of encouragement, or what might you say to those new riders coming on to encourage them to raise funds for projects?
Yeah, so the first thing I would say, thank you, because it takes an effort to do this sort of thing. So we're grateful for anybody who supports our work. But I would say that don't be discouraged, because sometimes changes like this can take quite a long time to happen. So these are sort of things that aren't going to change practice and care immediately. So it can take years, for drugs to become approved and treatments to change. But I think just to know that you are making a difference, by your efforts and by your donations. And we do really, really value all of these donations, and we do not waste, any of the money that's donated, and all of it really goes towards the research. So it's just to be encouraged, and to be thanked, really.
Perfect. So on behalf of the Ovarian Cancer Relief Foundation and all of the Dawn Riders across the country, I want to thank you for taking time out of your busy schedule, and I'm truly honored for the work that you do, the research that you're providing, and thank you. It's been an honor.
Thank you. Thank you, everyone.
Thank you.